My name is Noemi Arguello. My topic, coronary artery occlusion from Kawasaki disease. Definition. A coronary occlusion is the partial or complete obstruction of blood flow in the coronary artery. The condition may cause a heart attack. On the other hand, Kawasaki disease is a cause idiopathic cell limit. Maculis, the primarily affected children.
Hello, my name is Josh Cook, and I'm the Division Chief of the Pediatric Intensive Care Unit and the Cardiovascular Intensive Care Unit at Phoenix Children's Hospital. Today we're going to be talking about a syndrome that has been diagnosed in children across the globe who may be related to COVID-19. This syndrome is actually very similar to a disease that we know how to treat in pediatrics and we have seen for many years called Kawasaki syndrome. These children present with a number of symptoms. There are 6 symptoms that most of them have, maybe not all 6 symptoms, but a variety of them. And those include a fever for more than 5 days, a rash, a red rash that's concentrated either on the axilla or the groins. They have a strawberry red tongue, red eyes, swollen or peeling feet, and a swollen lymph node. Now, again, these patients may not have all 6 symptoms, but many of them have 4 or 5 of these symptoms that bring them to medical attention. The children do not seem to have problems with breathing, as we have seen in many adults with COVID-19. Instead, they may have abdominal pain or diarrhea or vomiting that shows up along with these other symptoms. This is important to bring your child to medical attention because they are at high risk for having other problems beyond the rash and the fever. Children with Kawasaki syndrome and children with this syndrome that seems to be related to COVID-19 ultimately are having inflammation in their heart also. So at Phoenix Children's Hospital, we know how to treat Kawasaki syndrome. And if your child has a problem like this, we will be doing things like using a sonogram to look at the heart and treat with medicines that we know have been effective in treating Kawasaki syndrome. This can be a very scary time, and bringing your child to a hospital can seem daunting, but it's very important that you seek medical attention and either bring them to attention to your pediatrician or through the emergency department here at Phoenix Children's Hospital. Thank you very much.
Application in medicine. The doctor will do physical examination and order blood and urine tests to hear if the diagnosis the test may include blood test, electrocardiogram, echocardiogram. Pros and cons. Pros. With treatment in the sheet might start to improve soon after in the first gamma globulin treatment. It's a coronary artery aneurysm recurrence treatment might include anticoagulant drugs, stent, placement, or bypass surgery. And cons. Without treatment here, complications may the lower lasting, the sheer Howard feedback gamma globulin need to high in the last 11 months to the cheated most medicine vaccine.
Kawasaki disease before they've had fever for 5 full days, in part because the definition of Kawasaki disease is that you have to have fever for at least 5 days. But we do want them to be treated by the 10th day of the fever, because after that time, then you will begin to see the changes in the heart. So there's a window there where you want them to treat it between day 5 and day 10 of illness. That's the optimal window for treatment with the gamma globulin and aspirin.
User applicant in Ecuador. Some students utilised in the country showed a heat accident of the dioxide. It has been reported 22 in period of 6 years. Unter 228 in Roberto Giver Irizarde Children's Hospital in the city of Guayaquil and 5 cats in the period of 11 years until 2003 in the Hospital Metropolitan and Quito.
Spain sent a warning to fellow childhood illness specialists about a small but rising number of children becoming ill with a rare disorder. They reported a small rise in critically ill children who tested positive for COVID-19 who also had symptoms of Kawasaki disease. That's a rare childhood illness. It causes the walls of blood vessels to become inflamed. Symptoms include a high temperature that lasts for more than 5 days, rash, swollen glands, and red bloodshot eyes. It is treatable and not contagious, but if not caught early enough, can lead to serious heart problems. Scientists are still not clear what the link is between coronavirus and Kawasaki disease. So far, the CDC reports children diagnosed with COVID-19 typically have mild cases of the virus, but there have been deaths reported, so cases in children should still be taken seriously.
Conclusion: to reduce in the risk of complications in the sheet, Dr. Reed was to be headed treatment for Kawasaki disease as soon and possibly, preferably, will the in the sheet had a fever, be within the fit had 20 days.
These are the blood vessels that supply oxygen to the heart muscle. Because the heart muscle is always contracting, it needs a steady flow of blood to bring it nutrition and oxygen. When children develop Kawasaki disease, the walls of these arteries become inflamed. If we could go inside the blood vessels, we might see something like this. Normally, a cell layer called the endothelium protects the vessel wall and prevents blood cells from leaving. However, some trigger during the development of Kawasaki disease causes the endothelial cells to become activated and causes cells of the immune system to stick to the endothelium and leave through the blood vessel wall. Inflammation in the vessel wall is caused by immune cells gathering in the wall and liberating chemical signals that recruit more cells and further damage the vessel wall. Intravenous gamma globulin, or IVIG, interacts with these cells to quiet down the immune response, although the exact mechanism of how this is achieved are poorly understood.